Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
According to research, women more frequently ignore the signs of a heart attack than men, especially younger women. Maybe they don't recognize the symptoms. The symptoms are different than those in men, so it's different than the classic symptoms you see in a TV show. Or they brush off the symptoms of a heart attack. Part of that is a sense of, believe it or not, being embarrassed if they're not truly sick. Embarrassment could be really dangerous in this situation. I'm going to go into the typical symptoms of a heart attack in women in just a second, and then I'll go into some foods and nutrients that can help lower the risk of a heart attack in women. But there is evidence that women are concerned that they're not truly having a heart attack, and they hesitate to go to the emergency room. And this can be really dangerous because the longer you wait during a heart attack, the more damage that can occur to the heart. So according to the Center for Disease Control, heart disease, number one killer in American women. It's number one killer, period, in the world. According to recent data, 25% of women who passed away in a given year was due to heart disease. 25%, one out of every 4 women. Almost 2/3 of women who die suddenly of coronary heart disease, they didn't even report to their doctor that they had previous symptoms. So what's going on? So the problem is with a heart attack, most of us think of crushing chest pain, like stabbing horrible chest pain as the telltale symptom. But that's not always what occurs in a woman. That's not always the telltale symptom in a woman. Even in some men. The symptoms in a woman could be a lot less extreme. They could be a lot less dramatic than what you see in men. That's part of the issue. So women might ignore the symptoms, or they might recognize it as being something else and not a true heart attack. So, for instance, there's reports of women who've had heart attacks, and they think it's back pain. The back pain was escalating throughout the day. They thought it was simply a back pain. Or they thought it was food poisoning. We'll get into that because that's not uncommon. There was a report recently I read in some website, I forget which one. A woman had jaw pain, and she went to the dentist and had a couple of teeth removed, and then they realized the jaw pain was due to a heart attack. So there's a difference in the symptoms of a heart attack between men and women, but there's also a difference in pain perception between men and women. So, hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. Welcome to my episode, Heart Attack Symptoms in Women, How They Differ from Men. I want to thank you for tuning into our podcast today. You can find all of our episodes for free wherever you listen to podcasts, or visit invitehealth.com/podcast. And please subscribe and leave us a review. You can also follow us on Instagram, Twitter, and Facebook at Invite Health, and the info on this episode is linked at the episode description. So I want to get going because this is truly a super important topic. Men and women tend to experience pain differently. We tend to describe pain differently. And we have different pain thresholds. Women can generally take pain better than men. So women are the more likely of the two sexes to delay getting to the hospital. They also might feel silly. They think, what if I'm not having a heart attack? And like I said, that's a dangerous scenario. If you, I'm going to tell you some symptoms, and if you get them, you really should not be embarrassed. Go to the emergency room and tell them. Because if you wait too long, it becomes really, really, really dangerous. So if you're at home and you have symptoms when you're sitting on the couch, you need to call the ambulance. You need to dial 911. Now, there's complications like pregnancy. There's complications like diabetes. In diabetes, people don't feel pain as easily. Their nerves could be damaged. They're not getting the sensation. So they may not even have chest discomfort. So they have to learn the symptoms to look for. So what are the symptoms to watch out for? Obviously, everybody knows about chest pain. It could be chest pain, it could be tightness in the chest, or you might just feel pressure in the chest or some kind of squeezing sensation. It's really the most common symptom among both women and men. It's not always a really sharp pain like a stabbing pain. It's not always a crushing pain like you see in a TV show. Especially in women. They're more likely to feel tightness in the chest or a buildup of pressure in the chest or squeezing in the chest rather than severe pain. But look for this, because this is common too. When the pain goes into your jaw or radiates down your arm or in your shoulder, even in your neck or your back, because the chest pain, it's not always in the center of your chest. It could be on the left side, it could be on the right side. The problem is, if it's down by the digestive tract, if it's low in the chest, people might think it's like food poisoning or something, or just nausea, or a virus. So the chest pain can really radiate anywhere. If any kind of pain you get like that suddenly above the waist, consider that it could be your heart. That's an important clue right there. If it's going into your shoulder, if you feel like squeezing in your chest or pressure in your chest, think of it as possibly being a heart attack. And I'll tell you something that's common in women: nausea and vomiting. These are more common symptoms in women, which confuses the woman. And she might think she has a virus, or she might think that she has food poisoning. She had takeout food a couple of hours before. So for women, it's more easy to confuse the heart attack symptoms with digestive tract issues. Especially if the pain is not like in your chest or in your shoulder, and it's more like lower in the chest. So if it's lower in the chest and you have nausea and vomiting, that's going to fool you and you're going to think you have food poisoning. But consider, it really could be a heart attack. Now, sweating. This is a good one to know. If the sweating comes on out of nowhere, it's really important to make note that it could be the heart. And some people talk about a cold sweat. That actually happened to me once when I got a fright. This is crazy. It's going to sound crazy. I had a dream about somebody dying. I woke up the next morning and the person had died. But when I had the dream, I woke up in a cold sweat. First of all, time slowed down. It was amazing. And I was sweating profusely. It was like 3 a.m. I was sweating profusely, but I felt cold. I felt like ice cold. So that can happen. So if the sweating comes on suddenly, that could be a symptom of a heart attack. The problem is if you're already having hot flushes from menopause. I mean, that becomes more common with age. So how do you tell the difference? The sweating from a heart attack could be really extreme and it sticks around. Whereas the sweating from a hot flush, it's usually over within a minute or two. So that's how you tell the difference. So sweating is a sign. And also like feeling dizzy, like when you have a heart attack, you could feel like you're going to faint. You might even faint. You could feel lightheaded. You could feel dizzy. And that's along with the nausea. You don't have to have both. But that's a warning sign of a heart attack. Or you might have something wrong with the structure of your heart, so you should get checked out anyway. If you're feeling dizzy or you're getting faint, you really should get your heart checked out. Now, this is really scary if it happens in the gym while you're working out, because that can really indicate some kind of serious heart issue. Another thing you'll see, if it's a heart attack, it could be shortness of breath. It could be shortness of breath, especially if it came out of nowhere. Or if all of a sudden your stamina drops like crazy. So, I mean, these things are unusual fatigue. All of a sudden you have this unusual fatigue. You can't explain it. It's not your thyroid. It's not cancer. It's not anemia. You're getting enough sleep. It came out of left field. It came out of nowhere. That could be a warning sign. But of course, other things cause fatigue too, like thyroid conditions and depression and anemia. But, those things build up. This is coming out of left field suddenly. So, and also like I said, if you have a drop in stamina, it's important to note that could be related to a heart attack. So these are things for you to make note of if you're a lady. You might not have that crushing pain you see in a movie, like in The Exorcist. Remember the priest had that terrible chest pain? That might not happen. It might be more nuanced, like some nausea, some vomiting, some dizziness, some fatigue, sweating, things like that. Or mild chest pain, where you say, wow, it's not a heart attack, it's mild. So there are symptoms that'll help shield you ladies from heart problems. And the first one is quite simple. It's the mineral magnesium. Magnesium is core to human health, and at least 30% of Americans are really low in magnesium. A lot of people are not getting sufficient magnesium from their diet. Where do you get magnesium? You get in fish, green leafy vegetables like spinach and broccoli, a little bit in salad. You get in beans. And it's such an important mineral that I tell people, don't mess around, take a magnesium supplement. So let's talk about magnesium supplements for a second so you realize what's going on with them. There's different grades of quality as far as the ability to absorb the magnesium. So magnesium acts like a laxative, a stool softener, when it's poorly absorbed. So like magnesium chloride, magnesium sulfate, magnesium oxide, they're not the best absorbed magnesiums, so you can actually use them as a laxative because they stick around in the intestines. And they bring moisture into the stool and they help you go to the bathroom. So a really well-absorbed magnesium is going to lack a laxative effect, a stool softening effect. So the best one, in my opinion, the best absorbed, magnesium glycinate. It doesn't have the laxative effect. You could easily fit 200 milligrams of elemental magnesium into an easy to swallow capsule-shaped tablet, and you absorb it like crazy. And just taking that once a day, that's kind of like insurance that you're getting enough magnesium, and you're going to want to do that. Just a couple of things about magnesium. Magnesium makes the brain work properly. For instance, if you have a kid who's misbehaving and bullying and breaking things, etc., you want to give them some magnesium and you want to give them fish oils, and you'll see a turnaround, believe me. Magnesium in the brain is involved with the correct release of neurotransmitters so the brain is working properly and so that mood is better, etc. But also so you could sleep at night. It's hard to release melatonin from the pineal gland in the brain if you lack magnesium. So you need it to sleep at night. But conversely, you need it for energy in the daytime because magnesium is attached to ATP, which gives us most of our energy. ATP is what you make out of your food, and it's fuel for energy throughout your body. It's like 95% of your energy comes from ATP, but there's no ATP hanging around unless it's married to magnesium. Most ATP is like 95% of it is attached to magnesium. So in the daytime, you need magnesium for energy and for the brain to work properly, and at night, you need magnesium to sleep. You need magnesium for your immune system because you cannot activate vitamin D without the presence of magnesium. Your bones will break down if you lack magnesium. Even though there's a lot less magnesium in your bones than the amount of calcium or phosphorus, magnesium is just important because magnesium seals the calcium into your bone. And if you lack magnesium, your bone crystals expand and your bone becomes more friable, which means it's easier to break. That's what that means. So, and that's just some of the things magnesium does for you. So, but magnesium also helps prevent heart attacks and sudden cardiac death. So here's the journal Epidemiology. It's researchers in Sweden, and they're looking at drinking water, and they're looking at how that affects the heart of women. Does it keep them safe? And specifically, they're looking at the content of calcium and magnesium in the drinking water. It's a very interesting study. And they found that if you had sufficient calcium and magnesium in your drinking water, it lowered your risk of sudden cardiac death and heart attacks. They found that if you had a higher level of calcium in your drinking water, it lowered the risk of a heart attack in women by 34%. Okay, if there was enough calcium in your drinking water, it's true, because if you lack calcium, it affects the rhythm of the heart, just like it would affect the function of your other muscles. So if you lack calcium, you had a 34%, you had a higher risk of a heart attack. If there was more calcium in your drinking water, it lowered your risk of a heart attack, ladies, by 34%, whereas magnesium lowered the risk of a heart attack by 30%. So I'm reading from the studies right here. So here's the Journal of Women's Health. Now listen, I want you to take this very seriously, because this is lowering the risk of a heart attack in women, a fatal heart attack, and sudden cardiac death in women. So let me tell you what sudden cardiac death is. Nothing is scarier than sudden cardiac death. I don't like paperwork, but it's not as scary as this. A lot of people, the heart gets too much information and the heart shuts down. It's called a heart seizure. Happens to about 350,000 Americans per year on average. Sometimes fewer, a lot of times a lot more. So about 350,000 Americans each year have a heart seizure where the heart suddenly stops beating. Typically it's because there's too much information coming from the lungs into the heart. The heart gets confused electrical-wise. It works on electricity. And electrically-wise, it works on electricity and it shuts down. Here's the problem. Only 10% of those people will the heart start to beat again. So 315,000 Americans die in general, on average, from sudden cardiac death. When it doesn't start to beat again, it's called sudden cardiac death. So they're looking at magnesium. Does it prevent fatal heart disease and sudden cardiac death in women? But take this very seriously, because it's Alpert Medical School at Brown University. It's University of Buffalo School of Public Health. It's University of California in San Diego, their Department of Family Medicine. It's George Washington University in Washington, the Division of Cardiology. Indiana University School of Public Health, which is a great school of public health, by the way. Brigham and Women's Hospital, and Harvard Medical School. So I'm going to read you exactly what they say. Postmenopausal women represent the highest population-based burden of cardiovascular disease, including sudden cardiac death. Okay, that is a powerful, scary, startling statement to me. Postmenopausal women represent the highest population-based burden of cardiovascular disease, including sudden cardiac death. See, after menopause, things start to go bad in women's heart health. So they go on to say, now we're talking Harvard and Brown and Indiana University, etc. They go on to say, this study examines the association between magnesium intake and fatal coronary heart disease and sudden cardiac death. So let's discuss that. What do they mean by coronary heart disease? Arteries are usually big blood vessels that carry oxygen-rich blood away from the heart to supply the body with blood and nutrition, etc. But the arteries that feed the heart are much smaller. They're more like a sippy straw. So it's a lot easier to clog them, for them to thicken and stiffen and get clogged with plaque, like cholesterol plaque. That's called coronary heart disease, number one killer on the planet, number one killer in the United States, number one killer of women. So here they're looking at fatal coronary heart disease and sudden cardiac death. So they looked at 154,000 postmenopausal women who were part of the Women's Health Initiative. They were recruited as early as 1993. And they looked at magnesium, and they were updating their info. And they followed them for over a decade. And they found for every standard deviation increase in magnesium intake, listen to that. So for every small increase in the amount of magnesium in the blood, there was a statistically significant reduction. A 7% reduction for fatal coronary heart disease and 18% risk reduction for sudden cardiac death. So like if you went from 200 milligrams of magnesium a day in your food and supplements to 300 or 400, you'd have a huge reduction in the risk of coronary heart disease, death, or sudden cardiac death. So they found out women with the lowest intake of magnesium, averaging about 190 milligrams a day, had the greatest risk for fatal coronary heart disease, a 54% increase, and a 70% increase in the risk of sudden cardiac death. I mean, this is serious business, and this is a serious mineral. You know what? I have a lot more to say on this subject. It's a very important subject. So I'm going to sign off now and continue this in a second part to the episode. So thank you for tuning into our Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. Hope to see you next time on part 2 of this episode. And thank you for listening. And Jerry Hickey signing off for now.